Post-operative care and complication. احنا عندنا post-operative periods can be divided into 3 phases. Number 1, 2, 3. 1 is early, 2 intermediate, 3 late conval period. So early post-operative period. So it's the short stay or the early period after anesthesia. Okay. This period could be prolonged after the effect of anesthesia or muscle relaxant. So that's why the patient should stay in the recovery room اللي احنا نسميها PACU, which is post anesthesia care unit. طبعا at that unit the patient should be observed for the vital signs اللي هي heart rate, blood pressure, temperature, saturation as well, which is very important, especially after GA. So what is the anticipated complication that can happen? So residual effect of anesthesia or muscle relaxant, so prolonged effect expected in some patient. Okay, so they are reacting differently. Some of the patients that the effect of general anesthesia and muscle relaxant take longer time than the others. What can happen? So the patient becomes sleepy, decrease breathing depth, rate of, the cough reflux يكون weaker than the others because of the muscle relaxant. So he might get aspirated or desaturated. That's why we need to observe. So the patient should be monitored carefully, as might develop any airway obstruction, airway maintenance like oxygen supplementation, suction, oropharyngeal airway should be around. Aspiration. What is aspiration? What can happen? So that's why asking the patient to be to fast pre-op is very important, because if the stomach is full and the patient did not get awake and the muscle relaxant still affecting the muscle, so the patient could aspirate some of the material which was in the stomach and cause a problem. Okay. So in patient with full stomach, abdominal distension, intestinal obstruction, GERD, or post-operative nausea and vomiting. So to prevent that, pre-operative fasting is very important. Insertion of NGT is very important if the patient gets aspirated. Pre-medicated with BPI also is sometimes helpful. Treatment with suction, oxygen, intubation if needed. Bleeding. Hemorrhage from the surgical site or drain can happen. Coagulopathic patient or patient, either in coagulopathic patient, like if the patient has hematological disease or on anticoagulation, or from major dissection. So if the patient become hemodynamically unstable with this hemorrhage or bleeding, should go back immediately to the operating room. Acute MR, acute MI, or acute stroke can happen also during the immediate or early period. So especially in patients who had a history of coronary artery disease or CABG. Intermediate post-operative period, which is the in-hospital stay. patient الآن طلع راح من recovery room راح للغرفة أو للICU أو للHDU. So هذه هي intermediate period. So the patient can be in the high dependency unit HDU, which is less care, lower level than the ICU, or the intensive care unit, or regular ward. During this period, patient should have or get good analgesia, hydration, antibiotic, and also Dvt prophylaxis, with also good oral intake. Early mobilization is very important. Chest physiotherapy is very important to prevent chest collapse اللي بنقولها بعد شوي and pneumonia, and also Dvt prophylaxis is very important اللي هي حنقولها بعدين في محاضرات الفاسكولار, pneumonitic compression and anticoagulation. Drains and line should be removed when the patient is طبعا before discharge. Sometimes you keep it and remove it as an outpatient. Wound care and inspection of the early sign of infection is very important. That's why post-op day 1, 2, or 3, you have to check the wound to see if there is any sign of infection. Blood transfusion, if there is any active bleeding, is required as well. طيب, what other complication can happen during that period? اللي هي intermediate period. Fever, low-grade fever is expected. Why expected? At the night of surgery as part of SIRS. So during the first 48 hours, ايش اللي ممكن يكون? What is the source of, why there will be a fever? What is the source of infection? So atelectasis, it could be secondary to the atelectasis or lung collapse. During the 3rd and 7th day, يكون البيشنت ممكن تكون secondary to chest infection, يعني real pneumonia or UTI. After a week of surgery, usually is not infection, more like either DVT or pulmonary embolism. هذه differentials تحطها in your mind كويس لما يصير في fever and any post-operative case. Number 2, respiratory complication, like what? Like atelectasis. It's a minor lung collapse. كويس. Especially post-abdominal or thoracic surgeries. Why? لأنه يكون في difficulty in breathing after إنه عندك big wound in the cavity, so the patient feel pain when he inspirate and expirate. Okay, so يصير عندنا minor lung collapse, which will lead to hypoventilation. Okay, so that's why we have to prevent this and treat it immediately before going into complete lung collapse and infection. So usually we see it in the chest X-ray. We treat it with oxygen and chest physiotherapy. طبعا الكلينيكال فيتشر هي hypoxia, low grade fever and tachypnea. طبعا prevention قلتها من شوي. طبعا pre-operative smoking cessation is very important. Respiratory exercise, كل هذه الأشياء can prevent it, and we treat with usually oxygen and spirometry, intensive spirometry, early mobilization and hydration. This atelectasis can turn into lung collapse, complete lung collapse. كويس. Following untreated atelectasis, what will happen? Hypoxia and agitation. طبعا to prevent it, as we mentioned in the atelectasis, same things. Treatment طبعا it depends on how bad is that lung collapse. So patient should be shifted to the HDU or SICU, respiratory support, physiotherapy, bronchoscopy and aspiration, and طبعا intubation if needed. Lung infection, which is a different story, could be secondary to the atelectasis and could be secondary to the lung collapse, or could be just secondary because the patient has lung disease before. So you still end in a high-grade fever associated with what? With hypoxia, sometimes some chest pain, and it will be very clear in the chest X-ray. طبعا we treat it with an empirical antibiotic, and we send sputum for culture. ARDS, it's not ADRS, it's Adult Respiratory Distress Syndrome, ARDS. It's acute alveolar cell injury resulting in increased alveolar permeability. Okay, فاللي يصير عندنا huge edema in the interstitial lung tissue. هذه usually it happens in acute sick patient in the ICU, especially, not specifically post-op, even medical patient. So this condition usually end up with rapid respiratory failure and hemodynamic instability. Treatment طبعا with ICU admission, intubation. Pleural effusion can happen as well, usually secondary to upper abdominal surgery or lung infection, okay, or thoracic surgery. طبعا it's very clear, it will be very clear in the chest X-ray, and the treatment is respiratory support and aspiration or insertion of a chest tube or pigtail to drain this fluid. Pneumothorax as well can happen after diaphragmatic or esophageal surgeries. My clinical picture: chest pain, hypoxia, cough, and it will be very clear in the chest X-ray as well, as you see on the right side of this, on the right, lung. Treatment طبعا chest tube or pigtail to drain that air. Renal complication during the intermediate period. Urine collection retention can happen, especially after regional anesthesia, اللي هي spinal or epidural anesthesia. So طبعا treatment with Foley's catheter. Sometimes we just do in and out instead of keeping the Foley catheter the whole time. We do in and out just to release the urine and take the Foley out to prevent also the UTI. And if the Foley stay a long time, there is always a risk for UTI. UTI, urinary tract infection. طبعا we have some of the patients are more risk than others, like diabetic or immunocompromised patient. Clinical picture: fever, dysuria, frequency. Investigation, as you know, just urine analysis and culture. Treatment with antibiotic. Hematuria. طبعا some of the patients, especially those patients who are on anticoagulation or antiplatelets, or with some also of the urological condition. طبعا treatment is supportive with stopping the anticoagulation if possible. Renal failure. It can happen after prolonged period of hypovolemia, hypotension. Acute kidney injury can happen, or after some nephrotoxic medication or material like contrast, for example. So the urine output should be maintained between 0.5 to 1 ml per hour. طبعا treatment is treating the source of the acute kidney injury. Cardiac complication, including MI, can happen of those patients who has risk of cardiac conditions like pre-existing ischemic heart disease, or heart failure, or arrhythmias. Prolonged period of hypotension, hypovolemia, hypertension, all of that play a major role in occurrence of this complication. طبعا cardiac complication like acute MI. طبعا you know how to investigate with cardiac enzyme and ECG. With treatment, usually you have to consult cardiology, shift the patient to the CCU if needed, ABC, and supportive treatment. طبعا sometimes that patient needs to go for cardiac cath and coronary angiography and angioplasty. Arrhythmias ممكن تحصل بجميع أنواعها, including atrial fibrillation, which is the common. VTE, venous thromboembolism, can happen. طبعا أنت to prevent that, usually for any patient who gets admitted to the hospital, especially for surgery, you should get prophylactic anticoagulation. Okay, so Dvt prophylaxis dramatically decrease the incidence of post-operative Dvt and pulmonary embolism. طبعا risk factor for VTE اللي هي patients related like previous DVT, acute DVT, elderly, obesity, bedridden, stroke, all of those. Sometimes disease related like malignancy and pancreatitis, and sometimes operative related like hip or knee replacement surgery. Clinical picture of DVT طبعا هي غالبا silent, بس يكون عندنا leg and calf swelling and tenderness. طبعا with PE يكون في chest pain, cough, and tachypnea and dyspnea sometimes. طبعا the best investigation for DVT is a duplex ultrasound, and for PE the CT pulmonary angiography. طبعا prevention, as I mentioned it so many times, early mobilization, compressions and anticoagulation. Treatment طبعا with anticoagulation and IVC filter if there is any contraindication to the anticoagulation or resistance. Wound complication, We classify it as early and late complication. Early complication like hematoma, seroma, infection, and dehiscence. Late complication like hernias, scars, and contracture. On the left side of the screen, as we see, this is incisional hernia. This is a late complication. Here there is a dehiscence. Okay, and here there is a hematoma after a neck and ear surgery. There's a contracture after burn. There's a colloid and hypertrophic scar. Any question?